Welcome to Calm Mind and Healthy Body, our channel. In today's healthcare landscape, understanding the potential side effects of medications is more crucial than ever. Many people rely on various prescriptions to manage their health, but did you know that some common medications can lead to severe dementia? This video will explore 8 drugs linked to cognitive decline and highlight their dangers. By raising awareness about these risks, we aim to empower viewers to make informed decisions about their health. Join us as we delve into this important topic and discuss how to navigate the complexities of medication safety. Before diving deep into the main subject, if you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell. Hence, you will be updated on health tips, recipes, and wellness inspiration. I appreciate your support. Medication 1. Anticholinergics. Anticholinergic medications play a significant role in cognitive decline by blocking the action of acetylcholine, a neurotransmitter essential for memory and learning. Common anticholinergic drugs include antihistamines like diphenhydramine, certain antidepressants, and medications for overactive bladder. While these drugs are adequate for their intended uses, studies have increasingly linked their long-term use to an elevated risk of dementia. Research indicates that individuals taking high doses of anticholinergics over extended periods may experience accelerated cognitive decline. Understanding these risks is vital for anyone considering or currently using these medications, as it can influence treatment decisions and overall health outcomes. Medication 2. Benzodiazepines. Benzodiazepines are commonly prescribed to treat anxiety and sleep disorders due to their calming effects on the brain. While they can provide immediate relief, there is a significant potential for dependency and cognitive impairment with long-term use. Research shows that prolonged benzodiazepine use can lead to memory issues and decreased mental function, raising concerns about their safety, especially in older adults. Fortunately, there are alternatives for managing anxiety, such as cognitive behavioral therapy, mindfulness practices, and non-benzodiazepine medications like buspirone. Exploring these options can help individuals find effective solutions without the risks associated with benzodiazepines. Medication 3. Opioids. Opioids are frequently prescribed for pain management, offering relief for conditions ranging from chronic pain to post-surgical recovery. However, long-term use of these powerful medications can lead to significant cognitive side effects, including memory loss and confusion. Studies suggest that prolonged opioid use may increase the risk of developing dementia symptoms, raising concerns about their safety, especially in older adults. Given these risks, healthcare providers must monitor opioid prescriptions and consider alternative pain management strategies closely. By doing so, patients can achieve adequate pain relief while minimizing the potential impact on cognitive health. Medication 4. Statins. Statins are primarily used to lower cholesterol levels and reduce the risk of heart disease. However, the relationship between statin use and cognitive decline remains controversial. Some studies suggest that statins may have a protective effect on brain health, while others raise concerns about potential links to memory loss and dementia. This conflicting research can create confusion for patients and healthcare providers alike. It's essential for individuals taking statins to consult their healthcare providers about their specific risks and benefits. Open discussions help patients make informed decisions regarding their treatment and overall cognitive health. Medication 5. Antidepressants. Antidepressants are commonly prescribed to treat conditions like depression and anxiety, with various types including selective serotonin reuptake inhibitors, SSRIs, and tricyclic antidepressants. While these medications can significantly improve mood and quality of life, some studies suggest that certain antidepressants, particularly tricyclics, may contribute to an increased risk of dementia. Cognitive side effects, such as memory impairment and confusion, can occur with long-term use. It's crucial for individuals taking antidepressants to discuss any concerns about their medications with their doctors. Open communication can help ensure patients receive the most appropriate treatment while considering their cognitive health. Medication 6. Antipsychotics. Antipsychotic medications are primarily used to treat mental health disorders such as schizophrenia and bipolar disorder. However, their use in older adults, particularly those with dementia or related conditions, raises significant concerns. Research indicates that elderly patients taking antipsychotics face an increased risk of cognitive decline and other serious side effects, including stroke and mortality. Given these risks, healthcare providers need to practice careful prescribing, ensuring that antipsychotics are only used when necessary and that alternative treatments are considered. By prioritizing patient safety, we can better protect the cognitive health of older adults. Medication 7, muscle relaxants. Muscle relaxants are often prescribed to relieve pain and discomfort associated with muscle spasms and injuries. While they can be effective for short-term relief, these medications may pose significant risks for older adults. Many muscle relaxants have sedative properties, which can lead to increased drowsiness, confusion, and cognitive impairment. This is particularly concerning for elderly patients who may already be vulnerable to cognitive decline. Viewers are encouraged to consider non-pharmacological alternatives, such as physical therapy, stretching exercises, and mindfulness techniques to mitigate these risks. Exploring these options can provide effective pain relief without compromising cognitive health. Medication chapter 8, sleep aids. Sleep aids are commonly prescribed to help individuals struggling with insomnia and other sleep disorders. While these medications can provide immediate relief, long-term use raises concerns about cognitive health. Research indicates that prolonged use of sleep medications may lead to memory issues, confusion, and an increased risk of cognitive decline, particularly in older adults. Given these potential risks, viewers are encouraged to explore natural methods for improving sleep, such as establishing a consistent sleep routine, practicing relaxation techniques, and creating a comfortable sleep environment. Individuals can enhance their sleep quality by prioritizing natural solutions while safeguarding their cognitive well-being. We explored the critical link between certain medications and the risk of severe dementia. We highlighted the importance of being aware of medication side effects, particularly for anticholinergics, benzodiazepines, opioids, statins, antidepressants, antipsychotics, muscle relaxants, and sleep aids. Viewers must consult healthcare professionals about their medications to ensure safe and effective treatment. By staying informed, individuals can make better choices for their cognitive health. If you found this information valuable, please subscribe, like, and share this video for more informative content. Together, we can promote awareness and understanding of medication safety.